Welcome everyone to this online deliberative town hall. I'm Amy Lee. I'm the Associate Director of the Connecting to Congress project, which is led by the Institute for Democratic Engagement and Accountability, or IDEA, at The Ohio State University, and I'll be serving as moderator for this evening. Connecting to Congress is holding deliberative town halls with members of Congress from around the country on the COVID-19 crisis, including this session, where we're very pleased to be joined by Congressman Salud Carbajal, representing California's 24th Congressional District. We're also joined at the Congressman's request by local public health officials, Dr. Penny Borenstein, Health Officer and Public Health Director for San Luis Obispo County, and Dr. Yvonne Del Reynoso, Director of the Santa Barbara County Public Health Department. I'm going to briefly go over the agenda and the ground rules for this online town hall event before turning it over to the Congressman and our doctors for opening remarks, and then we'll get to your questions. First of all, just a word about us. Connecting to Congress is a nonpartisan, independent research initiative of political scientists at Ohio State University, the University of California, Riverside, and other universities. We're holding these deliberative online town halls with members of Congress and other elected officials from around the country on the COVID-19 outbreak and our response to it, including tonight's session. All of our town halls, like this one, focus on a single issue. We provide participants with nonpartisan background materials in advance so that you can have an in-depth conversation about the issue with your elected officials, and you can find those in the handout section of your control panel. We also work to bring together a diverse, representative set of constituents for these events so your lawmakers can hear from the full range of their district. Our Connecting to Congress events are independently organized and, again, nonpartisan. Congressman Carvajal has agreed to participate in today's session, but the format of the event is entirely up to us, and the questions and comments are entirely up to you. So I'll give instructions for entering your questions in just a minute, but first just let me explain our method for passing on your questions to Congressman Carvajal. So we, the Connecting to Congress research team, will simply be gathering the questions you submit in the order you submit them, combining similar ones or eliminating any that have already been asked and answered, and relaying them to the representative. If you've already asked one question, we are going to try to get to everyone's first question before we do anyone's second question. So keep that in mind if you have a lot to say. Questions that are truly off topic will not be added to the queue. However, we will take all those questions and pass them on to the Congressman after the event. It is okay to disagree with Congressman Carvajal or your fellow constituents, but we do ask that you remain respectful. And lastly, if we don't get to your question, it will still be shared with the Congressman's office after the event. So now that you know this, here are the instructions for asking a question or making a comment. Click the button with a question mark in your control panel, type your question in the box that pops up, and hit send. Your question or comment will be received by our Connecting to Congress team and added to the queue. If you don't see the question mark button, you may need to expand your control panel. So look in the upper right corner of your computer screen for a small orange rectangle with a white arrow in it. Click that and the control panel should expand. Then click the question button and you should be able to type in your question, and it'll be received by our team and added to the queue. We also do have translation ability tonight, so if you have a question and you're more comfortable in Spanish, feel free to type that in. We will ask it to the Congressman in English, and then he can reply in both English and Spanish. All right, we're just about ready to get started, but before I turn this over to the Congressman and our guests for opening remarks, our first couple of questions are actually for you. You should see this question pop up in the video feed. Have you lost your question, or have you lost your job, been furloughed, or had your hours cut due to COVID-19? Go ahead and click your answer and we will have that for you in just a few moments. We'll leave this open for just a few minutes so that folks can go ahead and vote. We'll just leave that open for a couple more seconds and then we will switch to another semi-related question. All right, so we'll go ahead and close that poll, and now we have another question for you, which is the federal government has provided expanded unemployment benefits of an additional $600 a week during the pandemic, but these additional unemployment benefits expired at the end of July. What level of expanded unemployment benefits do you think the federal government should provide? You can go ahead and enter your response in there, and we'll leave that open for a few minutes and compile those results and share them with you shortly. We'll give folks just about 5 more seconds to go ahead and enter questions. You can also start entering questions now whenever you're ready. And in just a moment, I will turn this over to Congressman Carvajal for opening remarks. All right, Congressman Carvajal.
Thank you, Amy. Thank you to the Institute for Democratic Engagement and Accountability at Ohio State University for organizing tonight's town hall. And a special thank you to our moderator for tonight's event, Amy Lee. Thank you. I am thrilled about this opportunity, nonpartisan opportunity, to engage with my constituents about the issues that matter most. And tonight, our discussion will focus on the ongoing COVID-19 pandemic and the uncertainty it has created in all of our lives. I am honored to be joined by 2 of our local public health officials and what I also call our heroes, San Luis Obispo County Health Officer, Public Health Director, Dr. Penny Bornstein, and Santa Barbara Public Health Director, Dr. Vando Reynoso. Before we hear from our public health officials, I wanted to give you a brief update on my work in Congress to address the COVID-19 crisis and support struggling individuals, families, and businesses on the Central Coast. Since the onset of this pandemic, Congress has passed 4 bipartisan relief packages, which were enacted into law. These bills included direct relief for impacted individuals, families, businesses, hospitals, support for local and state governments facing budget shortfalls, and funding for testing, tracing, and treatment. This included more than $77 million for our local Central Coast hospitals, health clinics, and frontline health workers. The CARES Act established the Paycheck Protection Program, also known as PPP, which provided over $1.16 billion to the Central Coast businesses, helping retain over 158,000 jobs. Nearly 3 months ago, the House passed the HEROES Act, which would continue to provide critical funding for pandemic unemployment insurance, additional direct stimulus payments, implement a national testing strategy, address budget shortfalls for state and local governments, and provide emergency funding for schools. As we speak now, the House and the Senate are working to find common ground on another relief package to address this ongoing challenge. I hope an agreement is reached soon because so many individuals, families, and businesses are hurting throughout our country and here on the Central Coast. With that, I would now like to turn it back to our moderator. Back to you, Amy.
Thank you, Congressman. Dr. Vando Reynoso, would you like to go next? Wait, I think you might be muted.
Yes, sorry about that. Thank you for this opportunity to share with you a few key points regarding our COVID-19 response in Santa Barbara County. As you are aware, the state data issues have created a backlog in us receiving the correct amount of positive cases, the number of tests, and thus the correct positivity rates. As you also are aware, we have been on the state's monitoring list for 58 days. Being on this list has impacted all of us in this county. It has restricted our movements. It has impacted our businesses. It has restricted our activities. And as a parent, I am disappointed that our schools can't open this fall for distance learning. So our focus here in the Public Health Department is to work with our community-based organizations, our governmental partners, our community residents, basically everyone, so that together we can reduce our case rates. We need to be focused, earnestly diligently focus on reducing our case rates so that we can return to some normalcy. We need to work together so that our children can go back to school. I am hopeful. I am seeing somewhat of a downward trend, at least in our hospitalization rates, 6%. And I'm hoping that by the time the state releases all of our correct case count, that I'll see also a downward trend. But I'm going to cling on to that hope because I am seeing changes in our community. I am seeing that people are wearing their masks more faithfully, that social distancing is being observed, that everyone is really looking for that hand sanitizer or the opportunity to rush and wash the hands. And we also need to work a little bit better, harder towards being smarter about gatherings. So with that, I will end my comments for now.
Thank you so much, Doctor. Dr. Penny Borenstein, would you like to also make some opening remarks?
Sure, thank you very much, and thank you for having me. My comments are quite similar to Dr. Del Reynoso. We, in this county, we're a small slice of the Central Coast that has always prided itself for the first few months of this pandemic and in general as being, forward-leaning and proactive and living in a healthy and well community. And for a very long time, we were not seeing the same ravages of this disease as many of our surrounding communities. And unfortunately, in the past month or a little bit more, we have not been able to stave off the inevitable in the same way. We now have in our county increased number of cases. We share that in dubious place on the state monitoring list such that our businesses and our schools are also shuttered at this time. And we have begun to see increase in our hospitalizations and our death rate, whereas we virtually were experiencing none of that until the beginning of July. So I know that our community can get back to that place, that when we use diligence and intelligence, and we have to get us to a place where we can coexist with this virus. I know that our community can do it. So it's all the same things that you heard in terms of wearing masks and social distancing and being smart about not gathering in large numbers or at all, not traveling, so that we can do the protection of our most vulnerable populations, as well as have some manner of normalcy so that we can all work and earn a living, so that we can have our children educated, so that we can have our mental wellness and our physical well-being. We need to find that sweet spot of coexisting with this virus, be out in our communities, but in ways that don't put us or our most vulnerable population at risk. And with that, I'm just going to turn it back over, and I'm very anxious for questions on this important topic.
Thank you, Dr. Borenstein. Thank you, Dr. Del Reynoso, and thank you, Congressman Carvajal. We do have a lot of questions coming in, but we have 90 minutes for this event, so keep them coming. Just click the question button and type them in, and we will get them added to the queue. Before we go to the actual questions from our viewers, I did want to share the results with everyone of the poll questions that we asked of the audience. And so in terms of the financial impact of COVID-19, a full 22% say they have lost their job, had hours cut, or been furloughed due to the pandemic, with another 2% saying not yet, but that they expect to. And in terms of unemployment, obviously that's a large number of folks who are unemployed. 61% favor keeping the amount of federal additional unemployment assistance at $600, with another 14% thinking that it should go to $200 a week, and 20% saying that they would prefer aid that makes workers whole up to 70% of their salary, and 4% calling for that to be ended. So we can see there's a range of opinion on what this all needs to be done, but no doubt that it is having a very severe effect on the congressional district. And so with that, we will go ahead and get to some of your actual questions. One of our very first ones is a very practical question, so I think for our doctors, and it is, what should people do to keep COVID out of their eyes?
Dr. Bornstein, I'll defer to you.
Yeah, so I wear glasses. That is one layer of protection. And not that everyone needs to at all times be wearing glasses or goggles or face shields, but probably the most important thing is to be cognizant of not touching your face, especially after you've been touching other people, and to do good hand washing. Those are the basics of preventing infection from entering, whether it's your eyes, your nose, your mouth, as avoiding touching your face. I know there's been some recent communication about needing to wear extra facial protection, but I think that's not necessary in all cases as you move about through the community.
Anything you'd like to add, Dr. Del Reynoso?
And I would just say that what I have seen is a lot of my friends, colleagues handling their face mask and playing with it and then touching their face. So I would just caution intentionally when you don't fiddle with your face mask and then hand washing after you touch it.
Thank you. Our next question is for Representative Carvajal. We have a constituent who writes in, I would like to hear your opinion on the Save Our Stages and Restart Acts. I see that you have not signed on as a co-sponsor for either, and I'm wondering if you could share why.
Well, there's over 4,000 bills. So unless I can get a little bit more of what that bill is and what it's about, I will look into it and see if it is a bill that I can support or not. But certainly if there was more information, I'd be able to address it more fully right now. But I did write it down, and I'll make sure that I follow up and look into whether it's a bill that I can support.
Our next question is about the San Luis Obispo Health Department, so we'll direct this one to Dr. Borenstein. Why has the San Luis Obispo Health Department not been more explicit on the methods and modes of transmission of COVID? If there were, for instance, 6 people infected at a 68th birthday party in North County, why not say so?
So we have reported that which we know. We want to be as open and transparent with our community as we can. In many cases, we can't know exactly what the source of transmission is. And this becomes even more true as we get more and more cases, and those cases have had many potential sources of transmission. So we do ask people in a very detailed way where they've been in the prior 2 weeks. We ask about church service, we ask about rallies, we ask about family and friend gatherings, we ask about, where they've been out and about. And in many cases, we can't particularly nail down the exact source of location. When we can, if someone, has only had one or limited number of sources of potential transmission, then we will report that. And we have reported that information out. It is on that basis that we know that the majority of cases for whom we do have source information, that it is far and away from friend and family gatherings. And that's why you hear us in public health saying repeatedly now to please limit your number of contacts, in your social milieu. So continue to use communication devices like this to stay in touch. I've ceased using the term social distancing. I don't want people to social distance. I want them to physically distance. I want you to stay in touch with your loved ones, but through apps like this, through outdoor events in very small numbers, in backyards, in parks, and getting physical exercise with masks as needed. But it is the gatherings that have really been the main source of transmission that we've been able to identify.
Thank you. Our next question is for Congressman Carvajal. Will there be a second round of stimulus payments to Americans?
I believe there will be, despite the differences in the negotiations that are going on now, off and on. I'm hopeful that we can, one, achieve an economic relief package sooner rather than later. But there seems to be some bipartisan support around the issue of direct payments. Just like last time we had stimulus direct payments, there seems to be some agreement on doing the same thing again as one of the many things that will be included in a future economic relief package.
Excellent. And we actually have a poll question about that, where we are asking folks, do they favor another round of direct stimulus of $1,200 to adults and $500 per child to households of citizens and legal residents? If you'd like, you can go ahead and actually answer that now, and I will just pull up some of our next questions. We're getting a lot of these in. They are really, really great. Please keep sending them in. And we will just give you all a moment to answer that poll question, and then we'll close that up. And I will get on to our next question, which is also for the Congressman. All right, we can go ahead and close that one. All right, thank you. So our next text comes in from a constituent who says, I would really like schools to remain closed. I think it's asking for a disaster to open schools here in California. What can we do to ensure that our teachers, staff, and students remain on a distance learning plan until there is a vaccine?
Thank you so much. Well, I think we need to really look to our public health professionals, from CDC, our state professionals, and our local professionals, working together to make sure that no matter what, the health and well-being of our children is paramount. And whether we do that by distant teaching, by a hybrid, or by taking certain measures to make sure that we don't have the density of gatherings by our students, whatever the solution or measures might be, our public health professionals are the ones that are giving us their guidance and their advice as to how we can best achieve the safest environment with the least amount of risk. And I think with that information, officials will continue to make the best decisions, hopefully in the best interest of our children, but it should all be based on science and the guidance of our public health professionals.
Dr. Del Reynoso or Dr. Borenstein, would either of you like to comment on that?
Sure. I think Representative Carvajal said it very well. I, as a mom, would like to see my daughter back in school just because of that connection, the social connection, the physical connection, the mental stimulation that you just can't duplicate from a distance learning environment. That said, I'm also very worried about reopening schools when in our county, the prevalence of the disease is so high. And as a representative said, we have to be guided by science and ensure that when school opens, it is the safest environment for learning as well as for working as possible.
Anything to add, Dr. Borenstein?
Yeah, I think you'll hear me repeatedly talk about COVID as needing to provide a balance between all the protections that we need to have in place and really focus on related to this disease, but not neglect all the other side effects that may come to bear by virtue of the protections that we put into place. And I think the educational environment is one primary example of needing to find a balanced approach. So I think that the state of California's allowance for in those counties where there is high transmission to give consideration to schools and school districts for in-person instruction in some fashion for the younger children who, at least at this time, we very much believe, and there's evidence, are not as at high risk. We very much need to keep our eyes on teacher-to-teacher transmission, and the adults that may be vulnerable from children bringing the disease home, should they get it at school. But we have to weigh all of those considerations against the serious long-term damage that may ensue from children, especially certain groups of children, whether it's special education, English learners, homeless children, people with severe emotional disturbances. I am very much working with our County Office of Education, our superintendent, and within the state guidelines to provide mechanisms to not apply a one-size-fits-all, because I think it is critically important to the well-being of our children to both protect them from COVID, but also to protect them from the potential lifelong issues that may ensue by being out of the educational environment for so long, especially our special populations.
Could I add to that, Amy?
Sure.
And I think central to being able to achieve whatever approach we take for our schools and in our communities, central to all that is testing, to be able to do tracing and to be able to do make sure that we're doing, we have a handle on the numbers in our communities. And quite frankly, we're still waiting for a national testing strategy, working with our states and our local communities. I think Dr. Bornstein and Dr. Vando Reynoso could attest to the fact that we don't have the abundance of testing that we would like to have to really help us be more strategic in making these decisions for our schools, our local public health professionals. So testing is one factor that will be key. And the sooner we could produce a strategy and more testing kits and more reagents to help local communities like ours here on the Central Coast, the easier and the better it'll be for us to make better decisions and to reopen our schools sooner rather than later. But testing is one of those factors that is essential, and we don't have that a testing plan, despite Congress allocating the funds for this administration to develop one.
Thank you very much for all those comments. Our next question comes from a constituent who writes that their question is administrative rather than medical. When I was in the hospital in April, the rest of my family got sick, but not bad. I am counted in the headline numbers we see every day. However, my wife, who was tested positive for antibodies in June, is not included. Should they be included or at least reported to the public?
So in Santa Barbara County, we only count a case when that case has a PCR lab result attached to it.
So therefore, this person's wife would not have been covered. And okay. Do you think that that is a helpful measure for having people understand how prevalent it really is in the community?
The availability of the PCR testing or the antibody testing?
It sounds like he was talking about, or he or she was talking about the antibody testing.
Right. So I think that because it is not widely available, it would be an undercount of our prevalence. So what we do have is the availability county-wide of the PCR testing, and that's how we are gauging the prevalence of disease in our community.
All right.
I would add to that, in San Luis Obispo, it's the same. We do have eyes on the number of people who have tested positive by serology, meaning that at some point they may have been infected. We don't include those in our total counts of the people who have been confirmed to have been infected, and particularly our active cases. There's a number of reasons for that. One is the serology test. There's a lot of purveyors of that test, and not all of them have gone through the rigors of validating their tests. Secondly, even the ones that are approved have a lower validity than does the PCR or the actual test for virus. And thirdly, I would say the reason that we don't look to throw the serology counts in with those who've tested positive by PCR of the virus, it's still a relatively small number and may not be accurate, but also doesn't really tell us what's going on at a particular point in time in our community. So I look to the number of active cases as being a more important metric, because at the end of the day, if 3% or 5% or 10% or 40% of our community has been infected, that you may be able to get some view into through these serology results, we're still a far cry from what we need in terms of community protection, herd immunity, where we're talking 60–70% having been infected. So that's why we don't put for all of those reasons, we don't at this point in time put a lot of stock in the serology.
All right. Our next constituent asks, since the death rate in San Luis Obispo County has been 0.00007, do we need the draconian measures that are being imposed? Congressman, would you like to go first on this?
Well, I think we always have to look at the data, but the reason we are imposing certain measures are because our public health professionals tell us that if we are to contain this COVID-19 pandemic, we need to implement the measures that we are implementing. To not do that would see widespread infection and widespread death like we haven't seen yet. But we could get to a point where it could be extremely significant in terms of the amount of deaths. And then that data would shift rapidly, and then it might be too late. So that's why our health professionals are providing us the guidance and helping us develop the measures that we need to be taking to keep our community as safe as possible. I'll let them answer. They're our professionals, but I can just tell you what I gather has been the guiding framework of why we're doing these things. Nobody wants to keep everybody sheltering at home. Nobody wants to keep our children at home and not in schools. These things are not being done on a whimsical fashion. These things are being done with a lot of thought, a lot of science, and consideration for helping us get to a healthier place for our communities and our country and our state. But I will let them reaffirm that or disagree with me. But that is what I have gathered from all the conference calls, Zoom calls, all the advice we're getting from our professionals.
Dr. Villa-Reynoso, would you like to go first?
Well, actually, since it's a slow question, I'll defer to Dr. Bornstein first.
Thank you, though I'm sure we have both heard these kinds of questions before, and they're understandably part of the dialogue. Absolutely. I very much keep my eyes on ensuring that any measures that we take that impact our communities, our residents' ability to enjoy life, to earn a living, to educate their children. I know I've said these things before, and I say it on a daily basis. The need to support all of those things is foremost in my mind, as is the need to protect our community from the ravages of COVID. And I know that someone who's looking at it as a 0.0007% of our population is saying, well, there are no ravages, so why are we talking about this? This is true at this moment in time in our county, but we have seen nationally and globally that this disease is not just a flu. It is not like anything that we have seen in 100 years. And that if we were not to do any measure of protective measures, we would see something even way worse than we're seeing now. But just to put it in perspective, the worst flu season that we've had in decades was just a couple of years ago. We had 61,000 individuals in the US who died from that. And we're now 100,000 plus more than that in the United States. These deaths are primarily in vulnerable populations, primarily in older individuals, but not exclusively. And even with that, I don't want to imply that it's okay to write off people of the older generation. So with every decision that we make in public health, it is a balance. And I very much want to thank the Congressman for helping to convey one of the hardest organizations to convey risk to is related, public health is one of the hardest jobs that we have, and I've always had, is risk communication, because when we do our jobs well, no one knows that we exist and everything is going perfectly normally. We trust that the water we take out of our tap is good. We trust that we'll be prevented from having diseases by the immunizations that we take. We trust that there isn't arsenic in our soils. We trust all manner of public health protections that my industry has done, for hundreds of years now. But we've gotten better at it, and we understand that that we have to take action steps to prevent disease. And so unfortunately, at this point in time, it is a matter of prevention to take the least bad medicine we can. If everyone were to wear masks, and everyone were to keep their physical distance, and everyone weren't to gather in large groups, we could all be in school and have our businesses open. But that's not the place where we are right today. And I am very anxious to get back to that place, along with the person who posed the question and all of the members of our community. But we have to create the conditions where we can coexist with this virus at a low level and not allow it to just run through our community and cause way worse metrics than we've seen thus far.
So Santa Barbara, our death rate is about it's a little bit higher than Dr. Bernstein's county. But I would only add to the comment that the state is moving towards a regional approach. And I think it's important to note that some counties may have better stats than others, but because of the movement of residents from one county to the next, when there is higher prevalence of disease in one county, invariably it will impact your home county because of the recreational travel, the travel due to work, a variety of movement throughout our counties that we do need to keep that protective measure or a series of protective measures in place so that we can reach that happy space, that balance together as a region.
Thank you. Our next question comes from a constituent who says, I volunteer at a local food bank, and as you might think, demand is escalating tremendously. What ideas do you have, Congressman, for helping to mitigate the increasing food insecurity locally as jobs are cut and food costs escalate?
Well, certainly what we need to do is make sure that we are providing more assistance to our food banks. We did that in the CARES Act, and we hope to do it again in whatever economic relief package is negotiated in Washington that is occurring now. We also need to fund the 15% interest that has been discussed for supplemental nutrition assistance program needs. That provides essential nutritional food to millions of needy families and insecure individuals throughout our country. Working with our local food banks, working with our local essential workers, we need to make sure that we continue to invest in those programs that will continue to provide nutritious food to those individuals that are insecure in our country. And until we get out of this pandemic, we need to remember that there are many individuals and families and businesses that are hurting. People who we never thought would wind up in line at food banks. And that is happening pretty rampant throughout our country. So we need to make sure that we are providing comprehensively for the needs of all those individuals that are hurting. Like I said, be it an individual who's unemployed, be it a family, be it school children who depend on nutritious meals in school are not getting those as readily available. We're working with our schools to make sure that we have a mechanism to provide those meals to students, and in some cases now looking at even doing it more robustly with families. So we need to look at all that to make sure that we are taking care of the needs of all those who find themselves food insecure in our country, especially during this time.
Thank you. We have another question from a constituent who asked, how many times can you be tested for COVID for free? Can you all talk about the free testing resources that are available?
Let me just say, I'll let them speak from a practical standpoint because they see it happening every day. But from a federal standpoint, we provided funds in the CARES Act to make sure that testing was free. Now, the abundance of it is the challenge, but I don't believe that that there is a charge for testing, at least through our public health, public agencies. I know that there's some private providers are issuing that, and I'm not sure how the insurance system is providing for those same tests. And I would also be curious to hear that answer from our two public health providers.
So we in Santa Barbara County do offer through our state-sponsored OptumServe testing sites in Santa Maria, in Buellton, and in Santa Barbara free of charge. And it is free. There is no limit on the number of tests that you can take. However, there's a big caveat. Given that we are in another stage where there isn't an abundance of tests available, we want to make sure that we are mindful to reserve those tests for our essential workers, for our first responders, for other high vulnerable populations who are symptomatic. And so while the opportunity for testing is always there, we will not screen someone out for having 3 or 4 tests. We also want to encourage that to seek a test, not out of curiosity, but really out of a need to be tested.
Dr. Borenstein, would you like to add anything?
I would like to say that insurance is charged, even at the state sites and at our community sites, but no one is turned away for lack of ability to pay or lack of insurance. If they don't have medical insurance, it is free of charge, and there is no copay for those who do have insurance. I do know that in healthcare provider settings, be it urgent care or in a private physician's office, there is no mandate to waive the office fee. And that's why it's been very important for us to set up these community sites so that people who can afford the office fee or the copay or deductible that goes along with that will actually have no personal charge for getting tested. But I absolutely concur with Mon about requesting of our community to not just periodically get tested for the sake of testing. Again, we will not turn anyone away, but we are recommending that it be prioritized for those who either have symptoms, have been in contact with someone known to be infected, or part of a group where there may have been exposure, and to not routinely test just to see what your status is on a week in, week out basis.
Understood. Thank you. Viewers, we can still take more questions. We have quite a few still to get through, but if you have something based on something that you've heard so far since we've begun, feel free to go ahead and enter those in and we'll add them to the queue. Our next question is for the Congressman. Senator Sanders has brought up the possibility of a windfall profit tax on extra profits made during this crisis. Can you support this idea, which by the way applies in many other cases, and do you see any hope for this concept?
You know, in Washington, everybody's full of ideas, and certainly we need to look at all of them to see how we might be able to, in a practical fashion, get to a better place where we are reducing healthcare costs, prescription drug costs, and really shoring up our healthcare system so it continues to be more accessible and more affordable. And I think there is not a shortage of ideas, but rather a shortage of collaboration, and that's what we need to be able to work in a bipartisan way to continue to shore up and enhance our healthcare delivery system. You know, it's a shame that we live in the most industrialized, I would like to even say the most powerful country in the world. And yet having the best healthcare is one of the things that has eluded us. Certainly we have good healthcare, and in some cases, excellent or the best healthcare, but there's plenty of areas that it may not get the excellent level because it's not as affordable and is not as accessible. So while we might have the best care, we have so many people who don't have access or are underinsured. And we need to make sure that we look at every possible way to make our healthcare delivery system even better.
Thank you. Our next question comes from a constituent who says, I was surprised Newsom opened up businesses so quickly, not seeming to follow his own criteria. Does the congressman think the state opened too soon?
You know, the governor has to look at all considerations, and he has access to some of the best medical professionals, and certainly he has to make those decisions. Not having privy to all the information that he had, you have to hope that he made the best decision. But certainly, there has been times where I have questioned whether it was the best thing to open up too soon in certain instances or not. But, you know, I don't think I have privy to all the information that was available to him. So it's always easy to second guess. But without that information, I think we just need to hope and push for answers to make sure that decision making is as transparent as possible, so that we can help make that evaluation as this constituent is posing the question to me, so that I can have a better answer. But short of having all the information, it's hard to just be, it's hard to just say yes or no. I think for the most part, the governor has been doing a great job. But again, it doesn't mean that we have to agree with everything he does, or we don't have to question what he does. Certainly that's what makes our public process a good public process, and that is, it's okay to ask for transparency. It's okay to ask how those decisions were made, and certainly those are answers that the governor's office can and should provide to the public of California.
All right, we now have two questions from two different constituents about tourism and visitors to the area. So one is, why is tourism being marketed so strongly right now, especially in Santa Barbara, and also bars and restaurants being allowed to stay open 2.5 hours later each night? My industry, weddings and events, is totally closed, and it's so frustrating seeing Santa Barbara teeming with huge crowds every weekend. So there's one question about Santa Barbara, and then we also have a question about how is San Luis Obispo County informing their visitors to wear masks and social distance. So Dr. Vanda Reynoso, would you like to go first?
Sure. So the question is about tourism to Santa Barbara. You know, to be honest, we struggle with that as well, because we, from a public health department, believe that the less movement we have throughout our county, the sooner we can get a handle on our ever increasing case rates. With regards to why restaurants can be opened outside up to a certain hours and the wedding industry cannot. I believe that the weddings can occur outside in a small under certain conditions, and we are, because we are on the governor's monitoring list, we are abiding by the guidance by the statewide health officer order. So everything that we've put into place in Santa Barbara is in direct alignment with the state health officer order as to what can be opened and what cannot be opened, and the parameters around those.
Dr. Borenstein, on what is being done to warn visitors into San Luis Obispo about wearing masks?
So we have routinely messaged through social media, through press conferences, through press releases, through a targeted effort in some of our more common areas where we draw tourists from, that we don't want this to be the time of great tourism from outside of our county, especially in areas that are seeing much higher rates of transmission. We know it's happening. We have played around with lots of different ideas about how to tamp down the amount of tourism in our county, but still help our tourism industry to remain viable. I do very much understand and very sympathetic to the fact that there are other industries who haven't even had that amount of allowance. But our message continues to be strong and clear, and in many cases ignored, which is, we love you, we love our visitors, but please don't come here now, because we don't want to add to our disease rates of transmission. You know, with that, we work with our city managers, our elected officials throughout the cities and the unincorporated areas to try to utilize code enforcement, law enforcement to remind our visitors that our expectation is that everyone, our residents and our visitors, will comply with state mandates around mask wearing, around social distancing, around spreading out on a line on an entrance to a retail facility, a restaurant, etc. And we have in some cases cited businesses and individuals. We don't want to go there, but it's just, I keep saying the same things over and over again, is we collectively have to continue to work at finding a way to get through this period of time until we can find a better answer to this virus, which will come some months out, and a year in the life of our visitors of not coming to our shores is not going to really harm anyone. I've made this case, I've said it publicly, that this is the year that I'm not going on a big summer vacation. And I think out of our decades worth of life, that 2020 just may be that one time that we do things differently.
Amy,
Yeah.
I just wanted to add earlier when you asked me about the question about the governor. Like I said, I think for the most part, the governor's doing a great job, but it doesn't mean that we can't question decisions, that we can't give input, that we can't ask for more transparency. And an example of where I did push back on the governor was when we were considering whether we should open certain businesses in certain institutions in Santa Barbara County, for example. And the governor's metric system was including the numbers that were significant in the Lompoc Federal Penitentiary or prison. And it was hurting the positive disposition of containment that our public health officials had been working on. So it would be an anomaly to include such a huge number of individuals who contracted COVID-19. So there was an effort by some local officials, Santa Barbara County officials, myself, to write to the governor to let him, encourage him to re-examine the metrics to see if it was still valid, the decisions that he was making. So again, it's okay to have a conversation about some of the measures being implemented, but with working in good faith and trying to get to the best science. So I just wanted to reiterate that.
Thank you. Congressman, our next question is from you, from a constituent who says, I don't think government spending is the answer. How can we find a way to allow us back to work? We are capable.
Well, I think if you look at all the work product being put forth by the overwhelming number of economists, they will reaffirm the need for the type of investments that the federal government is making to assist those that are unemployed, to shore up our economy, to assist our businesses. I wish it was that simple. I wish we didn't have to spend any money. But the fact of the matter is, if you don't help people sustain themselves or businesses, they go in a spiral that puts strain not only on our economy, but on daily life and people's well-being, be it the loss of homes, being evicted, becoming homeless. If we don't provide the investments for our public health system, our testing, these are all investments that need to be made. I wish we didn't have to make all these investments. But the fact of the matter is we are dealing with a crisis that we haven't seen since the Spanish flu came about in the early 1900s. And this is a unique pandemic that requires us to implement unique and unprecedented strategies, including financial investments to help those that are hurting and to help our local economies and our economy throughout the country.
Thank you. Our next question is from a constituent who asks, what is the current status of contact tracing in our counties? What can we do to help counties prioritize more resources for testing and tracing?
That is a priority in our public health department. I am happy to report that it is a metric that we stay on top of, our ability to do contact tracing of the case and all the contacts immediately. So the state has an expectation that the contact tracing be completed within 3 days. And we, regardless of the backlog or the data dump, every time that we do get the information from our state database, we are able to not only do the contact tracing for the case and finish the contact tracing of all that case's contacts within the 3 days. So our average is right now 2.4. So that is a high priority in the disease, in the control of the disease transmission, to be able to do quickly, culturally appropriately contact tracing.
I concur with that. When we were running for the first couple of months of this, 3 to 4 cases a day, we had 4 or 5 contact tracers. We now have 25. We've been able to ramp up so that we can continue to make this our absolute highest priority. Is upon identification of any new cases. We aim for 24 hours. Sometimes we may have a day where we've had an unusually high number of cases and it will lag a little bit longer, but this is a top priority for us to communicate with our cases, identify contacts and communicate with those contacts and provide them with isolation and quarantine orders, but also to support them with their employers, to notify the employers about their status so that they won't be penalized in their jobs.
Right. So we have 68 contact tracers in our pool, and we continue to build on that. And happy to say that our pool reflect the linguistic and the cultural diversity in our county. So that's a very it's a very intentional commitment because the information that our contact tracers can elicit from the cases and their contacts are critical for us to take action on.
If I could say one more thing on that, We have seen more recently, especially as our case numbers have gone up, there is a reluctance on the part of some individuals to answer the call. And if I can use this opportunity, as I've been doing publicly messaging, please don't be fearful of getting a call from a contact tracer. The information is absolutely private. We will never ask for Social Security information. We never ask for immigration status. All of the information is medical and it's private, and we use it only to try to create the situation of prevention in our community. So please take the call, and please allow our contact tracers to communicate openly and fully with you when you do speak with them.
Congressman, did you want to say anything about funding for contact tracing or anything like that?
Well, it's part of the negotiations and the discussions going on. We included some funding in the CARES economic relief package that passed a while back, and we need to continue to add to those resources. So certainly making sure that states and local jurisdictions have the resources, not only for testing, but for tracing the people that are needed. The core of assistance and individuals that are willing to do this work is essential. And we have to do everything possible to make sure that we're providing incentives for people to be able to step up. Most people are doing it just out of the goodness of their heart. But to the extent, it would be great if we could also provide more incentives. And I think just making sure that we're providing local public health officials the tools and the funding would be very helpful.
Thank you. Another constituent writes in, for Congressman Carvajal, I meet all the qualifications for the first stimulus, but I did not receive it and the IRS has no information for me. Do you have any advice on how I can try and secure my impact payment from the first round of stimulus?
Absolutely. Call my office at 805-730-1710. Leave your name and number, and we will follow up with you to find out why that was the case. If you are being claimed as a dependent by somebody, even though you're over 18, that might be one of the reasons you didn't get your stimulus payment. We found that there were other reasons that that led to people not receiving their payments, even though they were eligible. So make sure that you're contacting our office. We will look into it with you and make sure that if it's something you should have received, it is taken care of. And if not, we will hopefully get you an answer as to why you were not eligible to receive your, why you didn't receive your stimulus payment.
And we will try to get that phone number posted in the chat and repeat it again at the end as well. Our next question is for you also, Congressman. If Congress does not come to an agreement on the next COVID relief bill, what likelihood exists for Trump's executive orders to be implemented, and what effects could we expect from that?
Well, I'm confident and hopeful that we will reach an agreement because so many people are hurting, and we really have no choice but to get on with it. The question is how soon and how much. Democrats are pushing for $3.5 trillion. The Republicans are pushing for $1 trillion. Speaker Pelosi's already said, let's meet somewhere in the middle, $2 trillion. And so we're hoping that that is the framework that moves us forward. But certainly that I think will take place. The executive orders put forth by President Trump, some there's a question whether they even have the legal footing. But the other one is they don't really have the funding that's needed to assist families. For example, state and local governments are already hurting. And I think one of the executive orders made $400 available for unemployment insurance to continue. But one of those $400, $100 needs to be provided by the state. Well, they're already going broke, so there's not too many states that are going to be able to step up to provide that benefit to their constituents. So that executive order is already faulty. We could look at some of the other ones, but again, providing a rental assistance or a moratorium on evictions is essential, but the executive order didn't do that. It made it seem like it did that, but all it did was direct federal agencies to look into it. So regrettably, the executive orders don't really have the type of relief that is needed or that could help those that are hurting. Certainly there's some assistance. I don't want to say that there's none that those executive orders would provide, but at the end of the day, they really provide little to no assistance like a good negotiated bipartisan economic relief package would achieve. And I'm hopeful that that will be the case.
Thank you. Our next question comes from a resident of Santa Barbara County who says, as a resident of Santa Barbara County, I'm well aware that the two populations most impacted by the pandemic are our agricultural workers and the inmates and employees of Lompoc Federal Prison. It's all well and good to protect our businesses, but we must also protect our most vulnerable. How will you extend your planning to ensure these populations are protected?
Thank you. Oh, I was just going to say, Dr. Vandal Reynoso, that that is an issue that is being recognized, not is throughout our country, about the essential workers that are farm workers. And I will tell you that the staff that work at the prisons, the HEROES Act that the House passed almost 3 months ago has over $200 million available to the Bureau of Prisons. That would include Lompoc Prison as one of the prisons that would get the assistance to be able to continue to address the COVID crisis in the Lompoc Federal Prison. That's one. The HEROES Act also has a lot of support for our essential workers, including our farm workers, that would provide for more personal protection equipment, child care assistance, even direct payments to those that have an ITIN number who did not qualify in the last go around. There was an assurance in the House HEROES Act to make sure that there was wide recognition that farm workers are essential workers, and as such, they need the support that they deserve. We can't, as a country, have it both ways. Look to farm workers as essential workers, but yet, on the other hand, treat them like they're expandable. We need to provide support to everybody that is hurting, especially our essential workers and our farm workers, and the Bureau of Prisons as well.
Thank you. Dr. Vanden Vernoso, were you going to add something?
I was just going to add that I also worry from looking at our epidemiology statistics that I do worry about the transmission to our vulnerable population, such as the ag workers. And early on, I asked community partners up at UC Santa Barbara and my trusted community partners that I had been working with to stand up a task force. And we called that task force the Latinx and Indigenous Community COVID-19 Health Response. And so through that, we identified barriers for farm workers to be able to test, access treatment, as well as accessing isolation and quarantine facilities. So as a public health department, we removed those barriers. We removed the cost, increase safety space so that community members can access those services. We continue to support that task force. It's a very robust task force that is very representative of our linguistic and cultural needs in our community, so that we are spot on in not only preventing the spread of the disease, but in serving the community during this pandemic. So there are subgroups in that. We are offering mental health services, as well as case management services, as well as just basic living and connection to other needed services. So that is a group that we've invested a lot of resources, and I'm really thrilled that that's something that we can do in order to protect a very vulnerable group of essential workers. On the other side, we have also been very aware and supportive of our correctional officers at the Lompoc prison. Although the cases out in Lompoc are not counted in our community, the correction officers and staff numbers are counted, and we work with the prison to track any outbreaks, any new cases as well. So we're in constant communication with them. In addition to that, we do also offer isolation and quarantine, a space for the staff at the prison, as well as partnerships with community-based organizations to make sure that during the isolation and quarantine period, there's access, their needs are cared for and addressed.
Thank you. So we wanted to let folks know, if you did have a question about that you need to contact the Congressman's office for, that number is available in the chat. If you click on the icon, the bubble with the 3 dots in it, you'll be able to see the contact info for the Congressman's office. You can still access that in the chat window. We also have only a few minutes left before we'll need to start wrapping up, but we have several questions on masks, and if we can get through some of those fairly quickly, we can get to a few more questions on other issues as well. So I'll get right into it. The first question is, can you give us the latest data on the efficacy of mask wearing? Have scientific studies been conducted?
So most of the understanding about the use of masks as primarily a preventive measure for the mask wearer to protect the other people in their environment comes from deductive research. So it comes from a number of ways. It comes from all manner of study about how far particles can move in the air, aerosolized transmission with and without masks. It comes from looking at mask wearing and non-mask wearing populations and the relative rates of transmission in those. What we don't have per se is an absolute, percentage of, if you wear a mask 100% of the time and it's 3-ply and you cover your nose, but not your mouth, or things of that sort. The research is continuing to emerge, but increasingly with the number of studies and the variety of types of studies, it has become increasingly clear that this is one of our most important protective measures. There also is emerging data on the fact that it may provide some protection to the wearer of the mask. So in public health for a very long time, we have often said mask wearing is for healthcare workers who are in direct communication with people with known infection, and we reserved all of our N95 masks for that purpose. We also reserved our surgical masks for known infected people, be it the flu or other types of respiratory illness, to prevent transmission. This disease is really, it's fascinating in some ways in that how different it is and how it's presenting and how quickly we are learning about it. So asymptomatic spread, the earliest studies coming out of China and South Korea and other places, we said a rare asymptomatic spread. Now we know that it's as much as 45% of cases are transmitted from people who have no symptoms. We didn't think children could get the disease at all. Now we understand that they can. So we are in a period of evolution of understanding about how this particular virus, as distinct from others, moves about the community. But that said, I want to double down on the idea, as somewhat of a late adopter, quite frankly, on the pros and cons of masks, that it really is one of our most important protective measures at this time.
What is being done to encourage people to wear masks in public and in indoor, particularly in indoor spaces? Sometimes people are confrontational. We need real enforcement.
So I think that we need to continue to work on changing the hearts of people. I think that everyone nationally, statewide, and locally have heard over and over all the different campaigns on the efficacy and the kindness and the to use on using and adopting the use of face mask. I think we need to continue to not only use data, but use the emotional impact of and really encourage people to do a heart change so that they can adopt this new behavior that will save our community. I think in addition to that, so education, changing hearts, and I also think that there's an element of enforcement that our county will be looking at in order to strongly encourage people to make the right decision about wearing masks.
Our next question comes from a constituent who asks, how will local budget shortfalls affect our ability to manage the virus? Congressman, would you like to go first?
Well, having worked in county government before I became a member of Congress, I will tell you that I think a good part of the funding comes from the federal government and the state government to help our local public health departments. But there's always discretion with some of the funding. And oftentimes that funding is essential for part of the functions that are carried out, in this case, to provide support for all the operations that go into assisting the response for COVID. So certainly we need to make sure that local governments have those resources. And that's why in the CARES Act, we provided for some funding for states and local communities that were impacted by COVID-19. And as a matter of fact, Santa Barbara County, if I remember correctly, Dr. Vando Reynoso, if you could speak to that, I believe got, maybe you could help me with the figures, over $40 million to help the local cities in Santa Barbara County. And in San Luis Obispo, we provided in the neighborhood of over $20 million was allocated from that state pot to San Luis Obispo to assist with their challenges. Now that is with how they've been impacted to date, not just public health, but other functions as well of local government and our public safety officials, you name it. So we need to make sure that local governments continue to get the support from the federal government and states during this very difficult time, because they rely, in addition to the state and federal funding, on local tax revenue, and that's been impacted greatly.
I want to just really take this opportunity to thank Congressman Carvajal for his unwavering support. We did receive $46 million through the CARES Act. And in addition to that, we continue to have supplemental revenues that's specifically for our COVID-19 response effort. I think for me, the issue isn't the funding. The issue is finding qualified people to join us to do the work. And so this is my plea to our community members. If you have a willingness to be trained to do anything from data analysis, disease investigation, nurses, clinicians, even administrative support, any of that, please join our effort. We are getting battle weary. and all counties are in this fight together. So the well of talented, skilled public health professionals are slowly getting lower and lower. So we really need the rest of our community to join us in this effort.
We have just a couple of more minutes. We'll just try to get to another question or two if we can. One of them is about a topic that I know all of us are very interested in, vaccines. So recent reports seem hopeful about a vaccine in the near future. What is your professional opinion about the prospects of a successful vaccine, and when is it realistically likely? And another constituent asks, when a vaccine does become available and able to distribute widely, will it be optional for each individual? Dr. Bornstein?
Yeah, so I hate to put out promises on timeline that will get people thinking if it doesn't come in January, we have failed as a public health community or a research community. But I think the most optimistic view, and where the vaccine candidates live at the moment, it is possible that we will have a safe and effective and mass-produced vaccine available at the beginning of 2021. That won't be known until we go through the full phases, 3 phases of clinical trials. I know there's news out there now that there's a Russian vaccine available. That is what America will not do, is rush a vaccine to market without it being fully tested. I do think that that we stand a decent chance that in 6 to 8 months from now, 9 months, that we will see something that will be widely available. On your second point of what level of mandate will be imposed, I can't speak to that. That's certainly not at my level. I think that will come from states and possibly at a national level, but I think that it will be widely enough available to provide the level, to decrease the level of transmission to a place that we can begin to move somewhat more normally through our community. I imagine it may be added to school and possibly even university requirements, which are the other places, as well as the healthcare industry, where we have existing laws for vaccine requirements. As to an individual mandate, I leave that to the congressman and others who will make those kinds of big policy decisions.
Congressman, we do have a question about the post office that I'd really like to get to, but did you want to talk at all briefly about the possibility of mandating vaccines?
I think those discussions certainly, I'm sure will take place, but it'll be based on all the advice of our public health professionals. It's similar to the vaccinations that we provide for children. Some vaccinations are mandatory and required, and it's for a reason. And there's been a few exemptions for those. But this is something that we've never dealt with before, this pandemic. And that's a public policy issue, and no doubt will be discussed and resolved in the near future as well. I don't know the answer, but certainly it's important that people raise it, because it's one of those issues that we're going to have to grapple with.
And I did want to get to one more last question from a constituent who says, as a person who is high risk for COVID, I will be counting on voting this November by mail. What is being done to protect our mail-in ballots from the current threats the president is making regarding denying funding for the U.S. Postal Service? Is there a legal process in place that will protect voters like myself who need to use mail-in voting?
Well, I just joined over 180 colleagues of mine in the House of Representatives who wrote a letter to the president asking him to make sure that the U.S. Postal Service is not undermined, and that any actions that are delaying our mail that are limiting the operations of our mail, United States Postal Service, are immediately addressed, because certainly individuals are concerned that there is a concerted effort to undermine our mail delivery by this administration. And the recourse we have is the legal recourse. One is to provide the financing we need to make sure the United States Postal Service has what it needs to avoid delays and to operate in a way that it is satisfactory. The HEROES Act provided for $25 billion to assist the United States Postal Service with support to address this COVID upcoming election in November. The counter proposal by this White House was, and the Senate were to provide a lot less funding. Last I heard, they were coalescing around 10 to 15 billion instead of 25 billion. It seems that there is progress being made in a bipartisan way to allocate some of the resources, hopefully all of the resources that are needed. But there is a negotiation going on, and it seems that hopefully if and when a negotiated COVID package is done in the next few days or a few weeks, that is one of the things that's included. So there seems to be an effort to provide some funding to the United States Postal Service. And yes, people have every right to be concerned when you're hearing certain statements that come from our president or the United States Postal Service of actions that have been taken that are not in keeping with having the type of functioning United States Postal Service that we are accustomed to having. Should this administration take certain unilateral action on its own to undermine the delivery of our mail, there's also the courts where I'm sure much legal action will happen, and the courts know what's at stake in November, so they will, I think, judiciously intervene. And if it goes all the way up to our United States Supreme Court, they too will address this issue, I think, hopefully promptly.
Thank you so much to all our guests for all the questions you've answered so far, and thanks so much to our participants for asking questions and staying so attentive to all this. I think just in the interest of time, we have one more question for our audience we'd like to get to at the end, and some kind of closing information for them about contacting your office that we'd like to share. So I think I will ask only Congressman Carvajal to go ahead and give us maybe a moment or two of closing remarks.
Yes, well, first of all, thank you so much. Amy, I'm hoping that as we close or when you close, you can also give the answer. I'm not sure that we got the answer to the last survey question. $1,200 for adults or $500 per child, to see what people said. I think that would be insightful information for all of us to have. But again, I want to just thank everyone that joined us tonight and our public health officials who were so eloquent in providing answers as they always have been. And thank you again to the Institute for Democratic Engagement and Accountability for providing this nonpartisan, non-staged, very transparent and open event tonight. And especially to our moderator, Amy Lee, and our public health officials, as I mentioned earlier. I hope the information provided tonight has been helpful. If we were unable to get to your question tonight, and if you require assistance with any federal agency, please do not hesitate to contact my office. Since the onset of this pandemic, my office continues to provide constituent services to assist in navigating all federal agencies. If you need assistance, please contact my office at 805-730-1710 or visit my website at carvajal.house.gov to send me an email. Stay safe, be healthy, and good night.
Thank you, Congressman. I do have the answer to our previous survey question about whether or not people supported additional funding for additional stimulus funding. And the answers came out that 83% of constituents, in fact, do, compared to 14% who were opposed. And we also, I will mention that we will be sending out a post survey after this to everyone who registered, where you have the opportunity to give your congressman some more feedback about your views on various policies related to COVID-19. So please, that should show up in your email tomorrow at the latest. Please do take a moment and fill that out for us. Thanks again to our doctor, public health professionals for participating, and of course to you, Congressman. Now for the audience, we do have one last question for you. As we've discussed, the COVID-19 outbreak is a public health emergency. And one of the ways that we can help is by sharing important information about it. So we would like to explicitly ask each and every one of you, any information that you heard tonight here that you thought was new or particularly important, please text or in some safe way share that information with other people in your network, especially if you don't know how engaged they are. A neighbor, a parent, a colleague, not every citizen can participate in one of these online town halls, but with your help, we can reach more people and share that reliable information about what we can do to slow the spread of the outbreak. So please go ahead and respond to this poll question. We'll leave that open for just another moment or two. As you're all responding to that, I want to let you know again that some of you will be receiving an online survey to provide further feedback about this session and more information about your opinions on this topic. You'll receive it at the same email address where you received your invitation to participate in this event, and your responses will be compiled and shared with Congressman Carvajal's office. Please take a few minutes. Lastly, again, if you would like to opt into Congressman Carvajal's newsletter, you can do so at Carvajal, that's carbajal.house.gov, and click on the e-newsletter button. If you have any additional questions about COVID-19, the resources and support available to you, you can find the contact information for any of his offices at carbajal.house.gov. The number he gave before, I think we have put in our chat as well, but it's 805-731710. If you have any additional questions about this town hall or our study, you can call us at IDEA at OSU at 614-688-3732. If you would like to sign up to do another one of these engagements with any of your participating elected officials, you can do so at connectingtocongress.org/citizens. Thanks again to everyone in our audience. Thanks again to our guests, and everyone have a good night. Stay safe. Thank you.
Good night. Thank you.
Thank you.
Night.